In this video, you will learn how to recognize the early signs and symptoms of a heart attack. Heart attack is the leading cause of death in Brazil and the world. According to the Brazilian Society of Cardiology, cardiovascular diseases kill around 400,000 Brazilians each year. The sooner you recognize the signs of a heart attack, the faster you can get to the hospital, receive better treatment, and have fewer long-term effects on your heart. This increases your chances of surviving. Therefore, pay attention. In addition to the initial symptoms of a heart attack, I will talk about the types of heart attacks, the causes of a heart attack, and why there has been a worrying increase in the number of heart attacks in young people under 40 years old recently. So be alert. SBC data shows that less than 5% of the Brazilian population can recognize the early symptoms of a heart attack. And many lives are lost as a result. What is a heart attack, or acute myocardial infarction, AMI? A heart attack is a scary experience. If you've had a heart attack or been close to someone who has, you know this all too well. As I mentioned, heart disease is the leading cause of death in Brazil and is a medical emergency. The heart is a muscle that pumps oxygen-rich blood and nutrients to the rest of the body through the aorta. On top of the heart, there are several small arteries known as the coronary arteries, and they supply the heart muscle with oxygen and nutrients. In a heart attack or acute coronary syndrome, there is a blockage in the blood flow in one of the coronary arteries. Atherosclerosis is the leading cause of a heart attack and results from the continuous deposition of cholesterol in these vessels over the years. Due to stress, a scare, vigorous exercise, or lack of sleep, plaque buildup can rupture. In the United States, where it is well documented, the transition to daylight saving time, where one loses an hour of sleep, leads to a peak of 24% in heart attack cases year after year, and when it returns to normal time, there is a 21% decrease in heart attacks. When the plaque ruptures, platelets will perceive and try to stop it, resulting in the formation of a blood clot, which then causes a partial or complete blockage of the involved coronary artery. Other less common causes are vasospasm, triggered by drugs such as cocaine, smoking, stress, or cold, resulting in a sudden spasm of the coronary artery, and coronary artery dissection, in which the inner wall of the coronary artery ruptures, resulting in a blockage of blood flow. Obstruction of any of the coronary arteries causes ischemia of the muscle, lack of oxygen and nutrients in the part of the heart muscle irrigated by that artery, which will cause the death of the heart muscle, the acute myocardial infarction. So, during a heart attack, the heart muscle tissue dies due to the lack of blood flow to that area of the heart. That's why we say time is muscle. The faster you get to the emergency room and get treated, the less damage to your heart. Conversely, the longer you wait to seek help, trying to wait out the symptoms, the greater the damage to your heart muscle. What are the symptoms of a heart attack? Often, people don't realize they're having a heart attack, either because they don't recognize the early signs or because they don't consider them serious enough to call for help. That's why it's important to pay attention to your body. Some heart attacks are sudden and intense. But most start slowly, with mild pain or discomfort. First symptom of a heart attack, chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts for more than a few minutes, usually 5 or more minutes. It's not a stabbing or pricking pain that lasts a few seconds, it's a longer-lasting pain that may come and go. It may feel like uncomfortable pressure, squeezing, fullness, or even burning in the chest. Second symptom of a heart attack, discomfort in other areas of the upper body. Such as pain or discomfort in one or both arms, numbness in the hands, back pain, neck, jaw, or stomach. Third symptom of a heart attack, shortness of breath. And this shortness of breath may occur with or without chest discomfort. Because if your heart can't pump blood well, as is the case with a heart attack, you may feel short of breath or have difficulty breathing. Fourth symptom of a heart attack, cold sweat and paleness. It's a sweat that's different from when you're exercising. It's cold, clammy, and the person is usually pale. So you suddenly start sweating, and your skin is cold and damp. Fifth symptom of a heart attack, nausea and vomiting. You may feel nauseous or have a gastric discomfort due to the vagus nerve reaction. Sixth symptom of a heart attack, dizziness. Dizziness can occur with a heart attack and is usually a symptom that women describe. Some women report feeling like they might faint if they try to get up or exert themselves a little more. Seventh symptom of a heart attack, anxiety. You may feel a sense of doom or feel like you're having a panic attack for no apparent reason. If you have any of these symptoms, don't wait for them to pass. Call emergency services, contact a family member or friend, call a taxi, or request an Uber to take you to an emergency room. In cardiology, there is the concept of the golden hour, where a person's survival will depend on the action they and the doctor take during the first hour of the event because most deaths from cardiac arrests occur during this period. Is there a difference in symptoms between men and women when it comes to heart attacks? Chest pain, angina, is the main symptom of a heart attack in both men and women. However, women tend to describe the pain more as a tightness or pressure in the chest, while men describe it as a weight on the chest. In addition, women are slightly more likely than men to experience shortness of breath, nausea and vomiting, and back or jaw pain. One common symptom in women is fatigue, to the point where some women may even think their heart attack symptoms are just flu or COVID symptoms. It's important to know that not everyone who has a heart attack experiences the same symptoms. Some people have mild pain, while others have intense pain. In some cases, such as with diabetics, they may not have any chest pain at all. There are also cases where the first sign of a heart attack can be cardiac arrest. However, the more signs and symptoms you have, the greater the chance that you are having a heart attack. Some heart attacks happen suddenly, but many people experience warning signs and symptoms hours, days, or even weeks before the event. The first warning sign can be recurring chest pain or pressure, angina, that is triggered by exertion and relieved when the person rests. If you can recognize these symptoms and act on them before you have a heart attack, even better. What are the types of heart attacks? There are two types of heart attacks. One is a ST elevation myocardial infarction, STEMI, where the clot completely blocks the blood flow to that artery, so the doctor can see through an ECG that you are having a heart attack. Since this is a more severe heart attack, the doctor will have to act quickly. The second is a non-ST elevation myocardial infarction, STEMI, where there is a partial blockage of the artery and unfortunately for the doctor, it shows up on the electrocardiogram, ECG, but the muscle is still suffering, and the cardiac enzymes such as troponin will rise in the blood test. What are the risk factors for a heart attack? As I mentioned, the main cause of a heart attack is atherosclerosis, so anything that causes atherosclerosis increases your risk of a heart attack. The risk factors for a heart attack include age. Men over 45 and women over 55 are more likely to have a heart attack. Women have problems later in life because estrogen protects them. Smoking. This includes both smoking and secondhand smoke. High blood pressure. Over time, high blood pressure damages the arteries that lead to your heart, causing atherosclerosis. High LDL, bad, cholesterol, low HDL, good, cholesterol, high triglycerides, high lipoprotein A, all of these increase your risk of atherosclerosis. Obesity. Obesity is linked to high levels of cholesterol in the blood, high levels of triglycerides, high blood pressure, and diabetes. In addition, visceral fat inflames the body, increasing C-reactive protein, which is a marker of cardiovascular risk. Diabetes. Over time, high blood sugar can damage the blood vessels and nerves of the heart. Family history. This is extremely important. If your siblings, parents, or grandparents had early heart attacks, at 55 for men and 65 for women, you may be at increased risk. It increases your chances of significant atherosclerosis by 4.5 times. Sedentary lifestyle. Being inactive contributes to hypertension, obesity, diabetes, and high cholesterol levels. People who exercise regularly have better heart health. Stress. Stress inflames, increases blood pressure, raises blood sugar, causes poor sleep, and increases the risk of a heart attack. Drugs, such as cocaine or even amphetamines, can trigger a spasm in the coronary arteries that can cause a heart attack. And in the long term, they cause atherosclerosis. Why have heart attacks increased in young people? According to the Ministry of Health, between 2010 and 2019, there was a 59% increase in hospitalizations for heart attacks in people under 39 and a nearly 10% increase in deaths. This is because risk factors, hypertension, diabetes, high cholesterol, obesity, stress, smoking, and sedentary lifestyle, are becoming more common in young people. So it is the dangerous lifestyle adopted by them that is to blame. And there is a problem, too, because in this population, the symptoms of angina, that chest pain when walking, may not precede the heart attack. What are the treatments for a heart attack? The treatment for a heart attack typically involves oxygen therapy to increase the amount of oxygen reaching the heart muscle, aspirin or other antiplatelet therapy, nitroglycerin and morphine to relax the coronary arteries and alleviate pain, and beta blockers to reduce heart rate and oxygen consumption in the heart. The doctor may also opt for thrombolytic therapy, which serves to dissolve existing blood clots or, even better, if they are in a prepared hospital, coronary angioplasty. For angioplasty, a thin, long tube, the catheter, will be introduced through an artery and reach the blocked coronary artery. The catheter has a small balloon at its tip. As soon as the catheter reaches the right spot, the doctor will inflate the balloon, squeezing that plaque of fat against the walls of the artery, opening up more space for the blood flow to return and irrigate that area. Stents are like little metal springs that will expand and cover that plaque. They are like tunnels that will not allow that plaque of fat to narrow or close that artery again. How can you reduce your risk of having a heart attack? You should reduce risk factors. Half of all heart attacks can be prevented simply by changing some habits. For example, quitting smoking reduces the risk of a heart attack by 30%. Keep your blood pressure under control, 120/80. If you have diabetes, it's important to keep your blood sugar well controlled to avoid all the harmful consequences of diabetes. Eat right, a healthy diet with little sugar, soda, and salt, lots of fruits and vegetables, little red meat and fried foods, reduces your cardiovascular risk. Reduce cholesterol and triglycerides. Exercise, get up and move. Try to lose weight if you are overweight or obese. Sleep well, 7 to 9 hours per night. And make friends. We know that loneliness and social isolation increase your risk of a heart attack by almost 30%. In addition, have a regular cardiological checkup. Those whose parents have had early heart disease should start earlier than others, around the age of 20. Cardiological exams are becoming increasingly reliable. Before, we only had non-invasive tests that made us deduce that the patient had no obstruction, such as an exercise stress test. Sometimes the person did an exercise stress test, ran on the treadmill, did not alter the electrocardiogram, had no chest pain, and the cardiologist congratulated them, only for them to have a heart attack a few days later. Today, we have more comprehensive exams, such as coronary CT angiography, which shows how the arteries look inside, whether there is any plaque without the need for a cardiac catheterization, which is a very good but invasive exam. Of course, coronary CT angiography is not for everyone. It is an exam that has radiation, uses contrast, which can cause reactions, renal problems, and is relatively expensive. But it's important to know that we have these cards up our sleeves, and from time to time, we need to use them. Finally, I want to issue a warning to those who are at risk of a heart attack or have already had one. Have an emergency action plan in case you or someone in your family is at high risk of suffering a heart attack. Write down the list of medications you are taking, and which one you are allergic to. Who is your doctor? What is your baseline electrocardiogram? Take a photo and keep it on your phone. Which hospital is closest to your home? Do they have a cardiologist? Do they have emergency hemodynamics? All of this can help you get the best and fastest medical care possible. Thank you for reading this article on treatments and prevention for heart attacks. It's important to remember that heart disease is a leading cause of death worldwide, but by taking steps to reduce your risk factors and seeking medical attention if needed, you can greatly decrease your chances of experiencing a heart attack. We hope this information has been useful to you and encourage you to leave your thoughts and opinions in the comments section below. Don't forget to subscribe to our channel for more informative content on health and wellness. Cha-ching!